take a seat. How are you today? Good, good. My name's Sarah, and I'm the doctor that's going to be performing your physical examination today for your application to join the army. Okay, it's part of the recruitment process, and obviously we need to know that your health is optimal for the role. Now, I know that the nurse has just taken your height and weight for me, so I'll be looking at that in a minute to make sure that's all within our normal parameters, and I'll also be carrying out some further little tests, just looking at, things like your heart and your chest, and looking in your eyes, throat, blood pressure check, a few things like that. Okay, firstly I'm just going to go over your medical history, okay, that you've previously filled in as part of your application. Okay, so are you comfortable there? Good, okay. Alright, so let's just have a look at this. Okay, so just confirm your name for me. Yep. Okay, and date of birth. Okay, that's great. And current address. That's fine. Okay. So, nurse has got your height and weight down there. Let me just check that on my chart. Yeah, that's fine. So your BMI is well within normal range. So that's super. Okay, now previous medical history. You've told us that you've never been diagnosed with epilepsy, and you've never had any seizures of any kind. No, okay. You've never been diagnosed with any other neurological condition. No, okay. You've never suffered from cancer. No, okay. You've never had any heart problems diagnosed or under investigation. No, that's super. You don't suffer from diabetes, either type 1 or type 2. Right. And you never had any previous surgeries. That includes surgeries as a child. Okay. No. All right. Okay. Have you ever had any serious infections? Serious meaning you were hospitalised or you were very ill for a long period of time. Okay. That's perfect. Okay. And you've got no current infections or recent infections, and no colds or anything like that recently. Okay, well actually I'll just check your temperature while we're on that subject, which will just indicate that everything's normal and there's no possible infections going on. Okay, so just sit still for me. There we go, I'm just going to insert that into your ear. Right. Okay, it's very quick. There. That's that part all done. Temperature's 37, so that's fine. Alright. So as far as the checks that I'm going to do today, I'm going to start off by just doing a little eye test. I will look into your eyes with a light, but I will also ask you to read some letters off a chart and also have a look at a couple of images just to check whether your colour vision is okay, because obviously for this role we need you not to be colourblind. So this test does not completely identify true colour blindness in its entirety, but if there are problems with this we would need to look at it further. Okay, but hopefully that's not going to be the case for you. Alright, so I've just got a light here. You see the light? And what I want you to do for me is just look straight at my nose. Keep your head still. Okay, I'm just going to be looking at how your pupils react to the light, okay, to make sure that everything's working there with the ocular muscles, okay. So just keep your head still, look straight at my nose, thank you. Okay, is that comfortable in your eyes? Okay. You don't get headaches or migraines, do you? No, okay. All right. Okay, well, everything looks fine there. Now this time I want you to still keep your head looking at me. Okay, don't move your head, just move your eyes and follow the light for me. Okay, thank you. So just follow this light. It's just going to come, there we go, right to left, left to right, and across down there, and across down there, okay, and from top to bottom. Keep following that light for me. Keep your head still. Okay. All right. That's great. I'll just mark that down on the sheets. Okay. Now, I'm sure you've seen one of these many times before when you've been to the optician. We just do a brief test here. If there's any concerns about your eyes, we'll refer you on to have a more complex eye test. Okay, so this is very basic. I just want you to cover up your left eye for me. Okay, all right, and can you read that letter for me there? Great, and that letter there for me. Okay, can you read that line there? Brilliant. Can you read the bottom line there for me? Super. And what's that number there? Great. Okay. So can you cover up the other eye instead now? Super. Okay. Can you tell me what that letter is there? Okay. Can you read this line for me? Super. And can you read the bottom line for me? Fabulous. And what's that number there? Great. Well done. Right. So this is the little colourblind check. Okay. Just check that that colour vision is all good to go. And can you tell me, in this square, what shape do you see? Okay, and what colour is that shape? Fabulous. And within this square, what shape do you see? Okay, and what colour is that shape? Brilliant. No problems there. Okay. So for the next part of your physical exam, I'm going to be using my stethoscope and I'm just going to check your chest, okay, have a listen to your heart, have a little listen to your lungs, and I'll also check your blood pressure as well. All right? Okay, so you just relax there, okay. Okay. Make sure this is nice and warm for you. Okay, can you just breathe normally for me? And I'm going to put the stethoscope onto a few different areas of your chest, okay, and have a little listen to your heart. Okay, just breathe normally for me, thank you. Okay. Okay. Okay, and just round the side a little here. Okay, and now can you just take some deep breaths as I ask you to, and I'll just have a listen to your lungs. Okay, so nice deep breath in and out. And again, in and out. Okay, and in and out. Okay, and in and out. Okay, can you just give a little cough for me? Okay, and another cough. Super. I'm just going to pop this over your back, okay, and have another listen there. So in and out, and in and out. Okay, and in and out, and in and out. That's fabulous. Okay, right. While I've got the stethoscope in my ears, I shall check your blood pressure, and I'm sure you've had this done before too. Okay, so I just need to pop the cuff on your arm and then inflate the cuff, okay? And we'll do that blood pressure reading. I'll do it on each side as well. Okay, so just outstretch your right arm for me. Thank you. Okay, let's get that on. There we go. Let's pop the stethoscope on your arm there. Make sure I can hear the pulse. Okay, and I'm just going to inflate that cuff now, okay? That's great. Let's take that off. Okay. And I'm just going to do the same on your left side. Okay, so just outstretch that left arm for me, thank you. Okay, let's get that on your arm. Okay, pop the stethoscope on there. Okay, and inflate the cuff. Okay, so just go tight again on your arm. Okay. All good, super. Okay, let's remove that. There we go. Blood pressure is 123/79, so that's fabulous. Let's just make a note of that. Okay, so we're all checking out well so far. All right, so you never had any abdominal problems, no gastrointestinal problems? No, okay. I'm just going to have a little palpate of your abdomen. All right. Okay, so just relax. Don't tense your muscles, just relax nicely for me. Just take one big breath in, just while I press under the liver. Okay. All right. There we go. Super. I'm just going to press in a few other areas around the abdomen. Okay. None of this feels tender at all, does it? Okay, that's good. Okay. And I'm just going to have a little tap. Okay. Make some percussive sounds. Okay, And that felt okay. Good. Okay. Can you just hold out your hands for me and cock your wrists back like that? Okay, that's fine. Let's have a look. Can you just hold it there for me? Fabulous. Okay, relax your hands. Okay. And just let me have a look at that hand again. I'm just going to check your skin and your nails. Okay. Thank you. That's good. Let's place that down. And can I have your right hand? Thank you. There we go. Relax the hand, that's fine. Okay. Okay. So for the next part, I'm just going to do a little peak flow test. Okay. So for that, I'm just going to put a mouthpiece into your mouth. I want you to tighten your lips around it, okay? And take a deep breath in, and when I say exhale for as long and hard as you can. This would just give us an idea of how well your lungs perform, okay? How much oxygen you can get in and out of those lungs. Okay, just bear with me while I set the machine, okay? Okay, just going to get a new mouthpiece. There we go. Okay, so mouth nice and tight around this mouthpiece for me. And there we go. Okay, take a nice deep breath in. Right, okay, and when I say go, exhale. Thank you. 1, 2, 3. Okay, keep going, that's great, keep going, perfect, there we go. Let's just see what the machine reads for me. That's all good. Okay. That's super. All right. So, I'm just going to pop some gloves on. Got some nice new gloves. They're ever so comfortable, which is great since we spend a lot of time wearing them. Okay. Right. I'm just going to have a little look in your mouth. Okay. Okay, can you open your mouth nice and wide for me? Okay, I'm just going to pop the tongue depressor in and just have a little look around. Okay, there we go. Thank you. Alrighty. And say R for me. That's super. And again. Okay. Alright. Fabulous. Okay. I'm just going to have a little look in your ears. Just going to use the otoscope here. Just going to insert it gently into your ear canal just to check there's no signs of infection or previous injuries to your ears. Okay? Great. with me. I'm just going to pop that into your ear now. Okay, I'll have a little look on this side now. Okay, that's all checked out fine. And can you just tilt your head back a little bit for me? I'm just going to have a little look at your nose. Okay. All right, lovely. Thank you. Okay. That looks fine. Thank you. That's perfect. Okay. So I'm just going to have a little feel of your lymph nodes around your neck. All right. Keep still for me. There we go. That's good. Let's just have a behind your ears there. Perfect. No lumps and bumps felt there, which is good. Okay. So did you bring your urine sample for me? You did? Okay. Well, I'll let you get that and I'll check that while you're here, but it will also go off to the laboratory as well for further testing anyway. But I've got a special stick that I can put in just to do an initial check of that. All right. Thank you. Okay. Thank you. I've got that here now. Let's just have a look. Okay. Well, that looks very clear. You've never had any problems with urinary tract infections, bladder infections, anything like that? No, okay. Just do an initial dipstick in here. Just have a little stick to check. Okay. All right. No. That's not showing any signs of any blood, white cells, proteins, any nasties in the urine sample there, so that's good. But we will just get our lab to double check that anyway, but I'm pretty sure that's fine because there's absolutely no trace of anything showing in there. Okay. Okay. You're checking out really well, which is what we like to see. Okay. Have you got any questions for me at this point? No. Okay. That's fine. Okay. So you've had no musculoskeletal problems at all? No broken bones? No. Okay. Can you just move your left arm above your head for me? Great. And your right arm? That's good. Okay. Can you just move your neck to the left for me? Just turn. Okay. And the other way. Okay. That's good. Okay. All right. That's super. Now, we do like to do a very basic hearing test, okay? There are further tests that can be done if something is picked up with this little test that I'm about to do, but hopefully it's not going to be a problem for you, okay, because you have said you've had no previous ear problems, no hearing problems. All right, so all I'm going to be doing, I'm just going to whisper a few words into each ear, okay, and I just want you to repeat those words to me afterwards, okay? Alrighty, so close your eyes for me, okay, so let's go with your left ear first, okay. Chocolate, house, dog, whiskers, okay, ice cream, bicycle, tablet, did you get that one? Good. Okay, donkey, good, okay. This here didn't seem to pick things up so well, did it? Right, I think what I'll do, I'm not saying there is anything wrong, but you did stall on a couple on that side, so I will just refer to our audiologist, okay? You can just do a further test on that just to make sure that's okay. Alright. The other thing, if you just close your eyes for me, just tell me what side you can hear my gloves rustling. Alright, okay. 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 And I'm going to rustle my gloves close to your ear, and I'm going to then move the gloves further away. Okay, so I want you to tell me when you can no longer hear the gloves rustling. Okay, we'll start with your right ear. Okay. Okay, and your left. Okay. So let me just make a note, just to get the ears double checked by audiology. Okay. They are actually here today, so there's a good chance they could check you out. It's only a short test with a series of beeps. Okay. It's done in a special booth. Okay. Hopefully we'll get that done for you today. Right. Going to remove my gloves. Okay. So, everything is checked out fine today with all the other tests apart from the hearing. So I'll walk out with you and go to audiology and we'll get them to check that out. So as far as I'm concerned, everything is good to go. This will all go back to recruitment, yeah, and they will carry on with your application process and hopefully you'll be joining us very, very soon, yeah. Okay, so let's take a walk out to audiology and get that ear checked. All being well, that's nothing to worry about, and you'll be able to get all signed up. Yeah? Okay, come on, let's go.